Hello, this is Olga Tamanova and the team of Ukraine Media Center at Ukraine Inform. And now we have the 9th year of war and 103rd day since a full-scale invasion. Today we have the Day of Journalist here in Ukraine. I congratulate you on this holiday, everyone who is fighting at this informational front, everyone who is helping the world to learn the truth about the war that is happening in Ukraine right now. So please take care, and once again, congratulations. Today at 12:30 we will have Tamila Tasheva, the president's representative in the Republic of Crimea. We will talk with her about the illegal imprisonment of journalists and civic journalists in the Crimea. Also, we will be discussing the occupational journalism and the Russian propaganda narratives at the occupied peninsula. And then at 2:30 we will have with us Alexandra Matuziani, the Speaker of the Ministry of Defense. Right now, we will have Ihor Kuzin, the main sanitary doctor, and also Oksana Koshalko from the Center for Public Health and the Ministry of Health. We will be discussing the epidemic situation in Ukraine and also in the temporarily occupied territories, and also overcoming the contagious diseases. Dear colleagues, first and foremost, I'd like to join these words of congratulations on the occasion of your professional holiday. Indeed, it's very important that people like you are objectively covering the events happening in Ukraine right now. In my presentation, I'd like to cover the epidemic situation in the occupied territories, also describe certain areas about the main threats of contagious diseases outbreaks in the occupied territories, and also the actions taken to overcome those threats. I will start with the situation at the deoccupied territories. Of course, because of the Russian aggression, there are losses in the lives of civilians, also losses in the infrastructure, industrial, and also humanitarian. And we can see that even in the media, that there is evidence of breaking all the epidemic norms and limiting access to potable water. All of this limits possibilities to fight against contagious diseases. Since deoccupation, we have specialists of the regional and city disease control centers together with the consumer service representatives. And the regions are split into sectors where the specialists are investigating the samples of soil, water, air, making sure that the territory is indeed safe for the citizens to come back or for resuming the work of the infrastructure. If these tests show that there are some risks, there are some suspicions that the potable water can be of inappropriate quality. The quality of this water is marked together with the local governments. This information is also placed on the regional disease control websites. Also, we collect information on the incidents at industrial enterprises, such as oil storage facilities, oil processing plants, chemical plants. If any incident has happened, again, soil tests are performed in order to make sure that there are no outbreaks of infectious diseases. I'll give an example of Kyiv region. This work was happening between April 12th and the April 21st. Right now, this work is going on in Chernihiv region. 48% of the region has been inspected already, and also in Sumy region, 70% was inspected, but unfortunately, there are shellings once again in Sumy region. And in Zhytomyr and Kyiv region, this work has been completed in full. And I would like to point out the main 4 risks that we were noticing and would like to emphasize. The first risk is about the potable water. We understand that indeed in the occupied territories, because of the disruptions in the work of infrastructure, because of the destruction of infrastructure, we are observing inappropriate quality of water. In Kyiv region, we found 2 samples of inappropriate microbiological properties, so this water is unsafe, epidemically speaking, and 11 samples were of insufficient quality for the content reasons. So this water is unsafe for drinking in the long run. Also, there are risks of drowning the territories. Also, there is a risk of the spread of contagious diseases in the occupied territories, especially with diseases like pediculosis and typhus. And the 4th component here is the temporary halt of vaccination, which is observed in all the deoccupied territories. In Kyiv region, for instance, 56 vaccination sites have lost all of their stores of vaccines, and the stores needed to be refilled. The territories of these regions where the infectious diseases are working right now, these regions were under occupation in the times where the temperatures were lower, but right now there is summer, and unfortunately the situation can be worse in the territories that are occupied right now. And the situation in those territories, unfortunately, is quite complex. This is because we have very limited information about their sanitary and epidemiological well-being. Especially the situation in Mariupol is critical because of the mass graves and the lack of access to clear potable water. Judging from the warmer temperatures, the threats can intensify. We are not 100% sure about the possible outbreaks of contagious disease, but the lack of proper sanitary conditions and water supply can surely contribute to the spread of contagious diseases and intestine diseases. Quite often we are getting information about mass graves in inappropriate locations, and this again can contribute to the pollution of groundwater. So people residing in these territories need to be very careful when they use water from ground wells, and the water surely needs to be boiled because there can be infectious agents. Speaking of the presence of certain dangerous diseases, such as cholera, there was indeed such cases in the past. So right now we are focused on how to prevent such outbreaks now, and how to prevent them if possible. So what can be done in order to prevent such outbreaks in the occupied territories. First of all, we need to explain to people, educate people about the factors that contribute to outbreaks. We need to explain the rules of limiting the risks resulting from using the water from unchecked sources and improvised sources. Speaking of the spread of cholera, we have started intensified monitoring of all the possible cases. We are also monitoring the environment, and this is in fact what we are doing annually since January 1st. So all the information is collected on the central level from all the disease control centers. Today we have also checked the stores of antibiotics, rehydration medicines, and their availability in healthcare facilities. So the current response system can surely discover the first cases of cholera in Ukraine if they arise. Also, at the level of the Ministry of Health, we have sufficient stores of medicines, and also there are readiness plans in every region of Ukraine. Speaking of other contagious diseases, there are also systems of epidemic monitoring against diseases such as polio, and in the disease control centers there are sufficient stores of reagents and test material for testing for 22 different contagious diseases. Also, we have the stores of contagious disease vaccines till at least August 2022. So planned vaccination of children and adults can continue at least until August, and there are plans for future supplies of vaccine as well. So I encourage Ukrainians who are in relatively safe territories right now to be careful about their health, to take all the necessary prevention measures that are recommended by the central government and the disease control centers, and also follow the vaccination schedule according to the health condition of you or your children. Right now I'll give the floor to Oksana Koshalko, who will speak about the most critical and relevant diseases being monitored right now. Hello. Today I would like to focus our attention on the most relevant diseases as of today. These are the diphtheria, the polio, and other diseases. So this is the system run by the Ministry of Health of Ukraine. It still continues to function at the government control territories, and when the person has some suspicious symptoms, they are included into the observation. So if there are suspicions about the case of contagious disease, this information is provided to the Centers for Disease Control. Then all the possible factors are investigated about the reasons of the case and possible ways of transmission, and the response actions are developed. Speaking of the diphtheria and tetanus, these are the only two diseases that are included into the vaccination calendars for adults. So each adult in Ukraine has the obligation to be vaccinated against these two diseases at least twice a year, because it's relevant both for children and for adults. Diphtheria is only possible if the person directly contacts the ill person, and again, vaccination is a possibility. We can treat diphtheria as well, and we had anti-diphtheria serums, but it's more difficult to treat than to vaccinate. So every adult needs to be vaccinated once in 10 years. Tetanus is very dangerous because many people right now are getting injuries, and because of that they can get tetanus as well. The only 100% prevention method is vaccination. There are different vaccines available to adults and children. First and foremost, parents need to think about vaccination of their children, but you also need to think about yourselves. And tetanus is managed by vaccines. It is preventable. Speaking of the polio, there is an outbreak in Ukraine right now since the fall of 2021. Unfortunately, it is still here. Unfortunately, new cases are being discovered among children under 15, and this is again the basis of monitoring of polio in Ukraine. But also there is monitoring of enteroviruses in the environment. So both areas of work continue. Samples are being taken from people who have suspicions for polio. Also samplings of water are taken, of sewage water, to see if there is any latent circulations of those paralysis cases. And we had 55 cases since the beginning of the year. Right now their results are negative, but the situation is still there. And once again, polio is a preventable disease. It is preventable by means of vaccination. First and foremost, it's the children under 1 year that needs to be vaccinated with 3 doses of the vaccine. I'm speaking right now to parents who are IDPs. Even though you are not residing in your region of origin, you still can get vaccination for your children. Unfortunately, the vaccine coverage is very low right now, and this contributes to the spread of polio in Ukraine. Unfortunately, if a child gets polio, it can result in death sometimes, but also can make the child a person with a disability till the end of their life. Speaking of the cholera, it's an intestine disease, and in order to diagnose it on time, the system of epidemic monitoring is working. So the persons with a suspicion for this disease, they are tested for the cholera agent. So we have enough of the stores of the diagnosis material, and the cholera is spread through dirty water. This is the main path of transmitting this disease. Also, if the person eats the food that was cooked with this dirty water, and hence are the main epidemic measures. Please do not use dirty water. If there is no access to clean potable water, it is necessary to boil it, and this is the most effective approach. But you need to boil not only the water you are using for drinking, but also the water you use to wash vegetables, to wash dishes, even the water that you are using to wash your face. And this is also dangerous because this is yet another possibility to get infected. So one needs to remember about the rules of using safe food, clean water, boiling the water, and these rules are effective against cholera. So, speaking of the possibility of vaccination, has the pathway for adults changed since the beginning of the active phase of war? The adult population is vaccinated in the same way as before. Once in 10 years, every person needs to be vaccinated with the ADPM vaccine, and you can simply contact the nearest healthcare facility, even if it's not the hospital in which your family doctor works. And right now the vaccines are available. Yes, this is correct. You can vaccinate it, and it's much easier to prevent a disease than to treat it later. Speaking of the potable water, we understand that Mykolaiv, Donetsk, and other regions in the territories that are government-controlled, there are problems with water access. What is the epidemic situation there, and are there any cases of diseases registered? As of today, we do not know of any cases of outbreaks of contagious diseases, but we are still monitoring the situation. Your questions, dear colleagues? Can you please share? This is a question to both of the speakers. Actually, three speakers. I have three questions. So, concerning these four diseases, are there any changes in the numbers in these times of war, or are there any regional changes? Also, speaking of COVID-19, we are not noticing it much, at least in the media. Are there any outbreaks in the regions? And one more question here is about Mariupol. We are noticing that after these mass burials, there are dangers of outbreaks. But speaking of the contact line, the communities that are government controlled but close to the contact line, how is disease control is happening there, and what can be done to assist those communities? Let's start from COVID-19. I believe that actually COVID-19 is still here. Of course, the number of cases is lower, which can be explained by the fact that it's a seasonal disease, and usually in summer we could see lower numbers of COVID cases in the previous years, and last week we, for instance, had 1,600 new cases registered, both in adults and children. Many of the adults are healthcare professionals. Unfortunately, we are also registering little cases. Over the last week, there were 34 such cases, including one child. And despite of the fact that Omicron is the main kind of COVID-19 virus we have right now, still people with comorbidities can have quite a severe disease and severe consequences. Also, we have been tracking we have been sequencing coronavirus, and we are not noticing any changes about the previous situation with COVID-19. Speaking of the communities close to the contact line. We understand that, of course, the dangers are higher there. The medical infrastructure is quite often destroyed. So the mobile teams, supported by the international organizations such as WHO, Doctors Without Borders, and UNICEF, these mobile teams are providing medical services or taking care of hospitalizing people. In case of contagious disease, these teams are also trained on the algorithms of actions, and they will be providing this information to the disease control centers. Right now, in the communities where we have such teams, we are not observing higher numbers of infectious diseases. And speaking of the regional situation about the infectious contagious diseases. Well, even before the war, we had only single cases of polio, of tetanus, of diphtheria, and we do not see right now any changes in this regard in the regions. We only had one confirmed case of diphtheria registered this year. It was diagnosed on time, and all the person who contacted the infected person were informed, and the outbreak didn't happen. So no new cases were registered. So the epidemic situation is the same as before. Now, speaking of the monkeypox, we have heard about this disease. Have there been any cases in Ukraine? And is the general chickenpox vaccine effective? As of now, there are no such cases in the territory of Ukraine, no suspected cases even. The instructions for the treatment, for laboratory testing, and for the diagnosis were provided to the disease control centers and departments of health in the regions. Right now, the diagnosis is only available by clinical symptoms, but we are expecting by the end of the month the PCR tests as well. Speaking of the two vaccines which we have recommended, they are indeed partially effective against monkeypox, but vaccination against monkeypox itself is not recommended so far because the epidemic potential is low, and the chances of a real pandemic are quite low as well. So mass vaccination of the population is not recommended, and thus there is no discussion about the procurement of such vaccine. Tatiana Litvinova, Espresso Channel. The question to Mr. Litvinov about COVID-19 vaccination. It has been put on hold to some extent. So what about the people who had to be vaccinated or who had to get their booster dose but did not get it because of the full invasion? Right now we have CoronaVac and Pfizer. If people have been vaccinated with another vaccine, what is their algorithm of actions, and what do these people have to do? Thank you. Indeed, everyone needs to be vaccinated. Those who has not been vaccinated yet, or those people whose booster dose is due, need to be vaccinated. Indeed, the number of vaccination sites is lower right now, but in almost every region except for Luhansk and Donetsk region, the infrastructure is in essence sufficient to provide COVID-19 vaccines. Those who have missed either the primary 2 doses or the booster dose, they can get it if the 9 months have passed since the 2 initial doses. Right now, CoronaVac and Pfizer are the 2 vaccines used in Ukraine, and if a person has been vaccinated, with another vaccine, they can be vaccinated with another vaccine, and actually Pfizer is recommended as a booster in case of both a booster and the final of the two primary doses. We are expecting the new deliveries of Pfizer, and we are also expecting the new Pfizer formula, which will not require the solvent, but is expected to be as effective as before, and also its requirements for transportation are not as strict as before. The temperature between +2 and +8 Celsius is suitable. Thank you. I'm Elena Rebinska, the fifth channel. My two questions are about coronavirus. We know that the certification on coronavirus vaccination are limited. So what's going to happen next? Will there be as strict limitations as before, as prior to this full-scale war? And also, we have seen information from Mariupol, where the Russian occupiers were just bringing all the bodies of our dead Ukrainians to the landfills, and there is a probability of pollutants getting into the groundwaters, into the seas. What can be the consequences, and can we get any information about Mariupol, about the spread of diseases, and what can happen in the nearest time? Because we understand that it's summer, it's hot, there are rivers and seas. Indeed, the person who has been fully vaccinated is getting a 9-month-long certificate. After that, the certificate is not valid, and the person needs to get a booster. That's a algorithm. Right now in Europe, there are there is lifting of the COVID-19 limitations. In Ukraine, we were forced to do this because we understand that the full observance of COVID-19 limitations is impossible. So temporarily, these epidemic requirements, such as wearing masks, limitations of public gatherings without vaccinations, are not being enacted, but this is true only for the martial law period, and especially vaccination is something that needs to be observed. Right now, in many countries, there are discussions of already treating COVID-19 as one of the endemic diseases, seasonal diseases. We are also working on this, and most probably in the fall and winter this year, we will be approaching already COVID as an endemic disease. But still, vaccination will remain recommended, especially to people who have the medical prerequisites, those who have chronic diseases, those who have risks of a difficult health condition in case of COVID, and also, of course, people who have professional risks, people in the healthcare and critical infrastructure, in the law enforcement. And coming back to your question about Mariupol, as I have mentioned, the mass graves, the majority of them, pose a threat of polluting the surface waters and surface sources of water. So the residents of such territories are not recommended to use water, especially if there is information of a mass grave nearby. The main risks right now are focused on the spread of acute intestine diseases, because we have information about huge challenges with water supply and sewerage. Mainly these are such diseases as cholera, dysentery, and other food-related diseases. So this is the priority and something very relevant for Mariupol. No questions anymore? Thank you so much for finding time to join us. This was Ihor Kuzin, the Chief Sanitary Doctor of Ukraine, and Oksana Koshalko, the head of the Epidemic Monitoring